We now have the means to prevent the spread of SARS-CoV-2, the virus that causes COVID-19. During a year of crisis, unprecedented scientific collaboration successfully developed those vaccines. Vaccines that have been rigorously tested and approved have begun to be distributed around the world. Millions of people have been successfully vaccinated. But vaccines only work if people are willing to take them. And even before COVID-19, vaccine confidence was a problem. The global measles outbreak in 2018 closely correlated with the lower vaccine uptake in the United States and other countries. And now, with the emergence of COVID-19, vaccine confidence has varied considerably in the United States. People's willingness to be vaccinated seems to be closely connected with race, location, trust in science, and political outlook.
It's recommended, approved, and sometimes mandated by government. It's made by big business, developed by the scientific community that is often perceived as elite. So if you have any issues with those domains, vaccines is the perfect place to take it out.
But other factors, like access to health insurance or medical care, may be the main issue for many communities.
The Black community in America has had deep reasons, going back to the Tuskegee experiments, which ran for 40 years, up until 1973, concealing syphilis experimentation on Black populations. And a large segment of the Black and Hispanic population remains somewhat aloof and unintegrated within the health system itself.
Among Black and Hispanics in particular, there's been years of concern about the quality of healthcare and the access to healthcare that's available, particularly in urban settings and communities that are not middle to upper income communities. I think it's very important that we are sensitive to the fact that there's a high level of distrust among both the Hispanic and Black communities in some portions of this country.
Improving access is no small task. But as the availability of COVID-19 vaccines increases, finding the time and space to create understanding will be critical.
Across the board, we can all do better. I call for a lot more listening. I think we are so pressed with time, and some of it is systemic, not squeezing time out of the time that you can have with a GP or a pediatrician or even a vaccinator, a nurse. Where can we get more time there or in waiting rooms? And just in public discourse.
Going beyond the health sector and reaching people in their communities can also play an important role in addressing people's concerns about vaccines and COVID-19.
We talk a lot about 9 key drivers of health that would help us achieve equity. Medical care, medical services is only one of them. And all of those are going to be very critical when we talk about these vaccination efforts. Some of them because they compete for people's time and their prioritization when they're making decisions. And then some of them will be critical in terms of the way that we have to structure access to these vaccine programs.
Americans are overwhelmingly desperate to get out from underneath the pandemic and return to their normal lives. And it's very important to get representatives of those industries, of those sectors that have the most to gain from reopening and the most to lose if we remain burdened by this pandemic, to speak out in an informed and knowing way, to encourage others to come forward and take advantage of vaccines that are proven to be safe and effective.
People's confidence or lack of confidence in vaccines is closely connected to how much trust they place in the health system and how secure they feel in their overall communities. As vaccine approval, production, and distribution accelerate, finding the right ways to listen to people and helping them make informed choices about vaccines has never been more essential. Because the choices people make about COVID-19 vaccination will determine community health, economic recovery, and even national security for years to come.